Welcome to Eltham College this evening for the 9th in our series of Peake lectures. This lecture series is named after old Elthamian and famous 20th century author and poet Mervyn Peake, the son of a missionary in the Far East. Mervyn Peake was born in 1911 and he attended Eltham College from 1925 to 1929, where he first developed his writing talents. He became a leading writer, poet, and prolific author of books, as well as an artist, and his works form part of the National Portrait Gallery collections, the Imperial War Museum, and the National Archives. He died in 1968, and he is also commemorated with a blue plaque on the house he lived in, central London. This is the 9th lecture in the series, and tonight, almost exactly 2 years since it launched, we again have a scientific theme, especially fitting for British Science Week. As usual, the format will be a lecture with some time for questions at the end. Jo Marchant is one of the country's finest science writers. Jo studied biological sciences at Leicester University, specializing in genetics. For her PhD, she researched medical microbiology at St. Bartholomew's Hospital and then completed UCL's renowned MSc in science communication. Jo began her career as a science journalist on the physics desk at New Scientist, was the news editor at Nature for several years, then returning to New Scientist as opinion editor before striking out as freelance journalist. She has written for just about every publication you can think of, including The Guardian, New York Times, and the Smithsonian. She has spoken at science venues and literary festivals all around the world, including the Royal Institution, the Hay Festival, and the Aspen Ideas Festival. There are many things that set Jo apart from any other science writers, but of particular note is her ability to communicate complex research in any scientific field, not just biology, but physics, chemistry, maths, and computer science, and intertwine it with history. Her book, Cure, was chosen as Book of the Year by the Sunday Times, The Economist, and the New York Post, and was shortlisted for the prestigious Royal Society Science Book Prize. Now, without further ado, please give a welcoming round of applause for Jo Marchant.
Hi, thank you so much for that lovely introduction, and thank you for coming. I'm really excited to be here to talk to you tonight about what science can tell us about the relationship between, I should go on to that slide, between our minds and our bodies, and in particular the role that our minds play in our physical health. Can our minds heal us, if you like? So we all know from experience that our thoughts and emotions can affect our bodies. If you imagine stepping out into the road and you're nearly hit by a car, you'll feel that jolt of adrenaline being released into your bloodstream, your heart starting to race. But can these biological changes actually have a significant effect on our health? And this is where the question becomes much more controversial and I think more interesting. So on one side, we have a lot of claims that are made for healing thoughts, miracle cures, often made by alternative therapists. These are some of the books that you can buy on the topic if you're interested. We've got Anything Can Be Healed, How Your Mind Can Heal Your Body. One of those books, Mind Over Medicine, the author says, we hold within us self-healing superpowers that are stronger than any chemotherapy and more effective than any surgery. So these are really strong claims that are made for the power of the mind. It's almost as if we don't need physical medicine at all. And then on the other side are the skeptics. Often conventional doctors and scientists, they would argue that any idea of healing thoughts is deluded, dangerous quackery. These are some quotes from opinion pieces. Some of these are from interviews that I've done with researchers. And they say that the idea that the mind can heal us is rubbish, tooth fairy science, oppressive and morally offensive. One said, why would actively doing nothing have any active physiological effect? It doesn't and it shouldn't. So strong feelings there as well. There are also fierce arguments within science. So these skeptics, they're actually not even talking about the claims of alternative healers. They're talking about scientific research into mind-body links from respected universities like UCLA and Harvard. So I kept coming up against this debate in my work as a science journalist, and it really fascinated me. So I'm trained as a scientist, as you've heard. I've written several books. I'm interested in the history of ideas, how we relate to nature and the universe, and in this case, how we relate to our bodies. And my book Cure came about because neither of these extreme positions really made sense to me. I wanted to get to the bottom of the argument and investigate what the research really says, but rather than jumping to one extreme or the other, I was interested in taking an evidence-based but open-minded approach to what the mind can do. So can the mind influence health? But if so, how and why? What can it do? What can it not do? So I spent several years interviewing psychologists, neuroscientists, doctors, patients, pioneers who were involved in cutting-edge research all around the world in this area. So today I want to pull some of that together, give you an overview of where the science is now and what I think are some of the most exciting developments. So we're going to talk about belief. We'll look at how and why our expectations and beliefs alter brain chemistry to shape what we experience, including medical symptoms like pain. Then action, how our experiences in turn act on our bodies through pathways, including the autonomic nervous system, and how this can shape not just our symptoms, but the physical progression of health and disease. And then change. So we'll look at some practical examples of how we can nudge our minds and bodies onto more positive trajectories. So what might healthcare look like if alongside drugs and surgery we paid more attention to what we believe and how we feel? Are there any principles that we can incorporate into our own daily lives? So let's start with the importance of belief and how we see the world for symptoms such as pain. And I want to tell you about a lady named Bonnie Anderson from Minnesota. So she was one of the first patients that I interviewed when I started looking at links between the mind and the body. And hearing her story helped to persuade me that there are important effects here that we need to understand better. So Bonnie told me how a few years earlier she had slipped over on wet kitchen tiles and fractured her spine, and she was left in a lot of pain after that. She told me that she wasn't able to stand up to do the dishes, she had trouble sleeping at night, she couldn't play the golf that she loved to play. So eventually she took part in a clinical trial of a promising new surgical procedure called vertebroplasty. And this is where surgeons inject medical grade cement into the bone to strengthen it. And it worked beautifully. It was wonderful, Bonnie told me. I was able to go back to my golfing and everything that I wanted to do. But what she didn't know at the time was that the surgery she received was fake. The surgeons acted out the entire procedure. She never received that injection of cement. And Bonnie wasn't the only one. There were 131 patients in that trial. Overall, their pain and disability scores almost halved, but there was no difference between the group that got the real surgery and the ones who got the fake surgery. So for these patients with fractured spines, the procedure worked, but their belief in the surgery was just as effective as the surgery itself. Now, this is an example of a well-known phenomenon, I'm sure you've heard of it, called the placebo effect, which I think is a really good way into thinking about mind-body connections. So with the placebo effect, when people receive a medical treatment, often they then feel better, even if it turns out that that treatment was fake, there was nothing in it. But even though placebo effects are well known in medicine, they're often dismissed as an illusion, something that fools us, that isn't real. Maybe the patients would have got better anyway, maybe they just think they're better when nothing has actually changed. But there is now lots of evidence showing that placebos aren't just fooling us. Actually, they can trigger important effects that are changing how scientists think about how many medical treatments work. Neuroscientists, for example, can now look inside our brains and see what happens when we respond to a placebo. And it turns out that the effects are not just statistical anomalies or all in our minds. Actually, scientists see measurable biological changes. And in many cases, these are just the same changes as occur when we take pharmaceutical drugs. So if you take pain, for example, it turns out that taking a placebo painkiller, so a sugar pill that you think is a painkiller, can trigger the release of natural pain-relieving chemicals called endorphins. And these bind to just the same receptors in the brain as opioid drugs like morphine. So there's no drug involved when you take a placebo, but you're essentially getting just the same hit as if you were to get a dose of morphine. And in fact, many drugs and treatments that we use to ease symptoms work at least partly, if not completely, through placebo effects. Even powerful painkillers that are given in hospital don't work anywhere near as well if people don't know that they're getting them. Sometimes they don't work at all. In one analysis of painkillers in tens of thousands of patients, the placebo effect accounted for about 75% of the overall pain relief that people felt. So 3/4, whereas only 25% of the effect was caused by the biochemical action of the drug. But pain is just one example. Actually, there are lots of placebo effects. So fake treatments for different conditions can trigger different beliefs about the relief you'll feel, and this can translate into different responses in the body. So patients with Parkinson's disease, for example, they suffer from tremors because of the lack of a chemical messenger in the brain called dopamine. And when they take a placebo, they experience a release not of endorphins, but of dopamine, just like when they take their drug. Another example is altitude sickness. So an Italian neuroscientist named Fabrizio Benedetti, he is one of the world's top placebo researchers, is researching this at this lab that he built high up in the Alps. So the oxygen level in the air here is just 2/3 of what it is at sea level, and that can cause symptoms like headaches, dizziness, nausea, sickness. And Benedetti brings people up here and he gives them fake or placebo oxygen. So this volunteer, he's called David, who was there when I visited. So you can see he's exercising on the stepper, and he thinks that he's getting supplementary oxygen from that canister, but actually the canister is empty. He is just breathing normal air. And Benedetti's studies have shown that when people believe that they're breathing extra oxygen, they have fewer symptoms of altitude sickness and they perform better on the stepper. And this effect too works through a measurable physical mechanism, in this case a drop in the level of chemicals called prostaglandins. So these are just a few examples of how beliefs can directly affect our biology. Actually, our brains have an entire inner pharmacy of molecules like endorphins, dopamine and prostaglandins that regulate our physiology and can create or ease symptoms. And many of the drugs that we take act on these pathways, and what these studies of placebos show is that our minds can influence these processes too. So one reason that placebos haven't always been taken that seriously by scientists until quite recently is because they're elusive and changeable. They're hard to pin down in scientific studies. We've heard how in different situations placebos can trigger different effects and mechanisms. They might work on some people and not others. The same placebo can have positive, neutral or even negative effects depending on what we're told about it. And this has contributed to an idea of placebo effects as dodgy and unscientific, not real. After all, there's nothing in a placebo, so how can one placebo be different to another? Like, how could nothing be different to nothing? But this is looking at placebos all wrong, because the placebo itself is not doing anything. There is nothing in it by definition. What's having the effect, the real active ingredient, is your psychological response to that placebo. So what receiving treatment means to you. And of course, that can vary between different people and in different situations. So the effects can depend on what we're told about a treatment, for example, whether a similar treatment's helped us before, whether we trust the doctor. There are individual differences depending on personality, even genes. Big pills tend to create larger effects than small pills. In trials, invasive or impressive treatments, so anything that seems like it's going to work really well, that they'll tend to trigger larger effects. So fake surgery, say, or placebo acupuncture will create larger effects than a simple pill. And there are cultural meanings and associations. So red pills tend to be good for easing pain, for example, whereas blue pills are more calming. They're better for treating anxiety or problems with sleep, except among Italian men. I don't know if anyone has any ideas why that might be. Scientists think it's because blue is the colour of their national football team. So for them, blue is exciting, not relaxing. So that is just to emphasise the fact that the effect is really nothing to do with the placebo itself. It's all about what that treatment means to you. So how far can we take this? What do placebos work for? Well, there isn't good evidence that just believing in a treatment will fix significant physical problems or damage in the body. They're not an all-powerful protective magic that's going to keep us well in every circumstance. So they're not going to lower cholesterol levels, banish a serious infection like malaria, or shrink a tumour. But placebos do work particularly well for easing symptoms of all kinds. They can dramatically shift how ill or well we feel. So that means they're effective for all kinds of pain, from the chronic joint pain of arthritis to the acute agony of a burns victim, as well as other symptoms like nausea, fatigue, itching, wheezing. There are big placebo effects for gut conditions, balance and movement, psychiatric disorders, including depression and anxiety, cognitive function, memory, sleep. So there are limits, but all of this is in itself a hugely important part of modern healthcare. And while there's lots of variability, placebos do, as I said, work through measurable physical mechanisms, and they often rival drugs in their effectiveness. So as I mentioned, across hundreds of trials, placebo effects account for around 75% of the effective treatment in pain. In Parkinson's disease, researchers have seen up to a 50% drop in symptoms, so that's about the same as you would get with a drug dose. And in a recent study treating itching in patients with dermatitis, researchers gave people a hidden drug dose. So they're getting the drug, but they don't know that they're getting it. So you're getting the drug, but no belief, if you like. And they compared that against a placebo, where you've got the belief, but no drug. And in this situation, the placebo worked better than the drug. You see similar effects for the negative effects of drugs too, side effects. In clinical trials, many of the side effects that are seen also show up in patients who didn't get the drug at all, just the placebo. A recent study of the COVID vaccine found that around 2/3 of the side effects that people felt when they got vaccinated were actually down to nocebo effects and were not due to the vaccine at all. So I want to come on to how we can use some of these effects, but first I want to address a question that, if you're anything like me, you're probably already asking, which is why. We might have a certain belief that a treatment's going to ease our symptoms or give us side effects, but why would that alter brain chemistry to make that belief come true? And to answer that question, I think we need to think about why symptoms such as pain, nausea, and fatigue exist in the first place. They're not there just to make us miserable. They have evolved as warning signals to alert us when we're in danger, persuade us to take action to fix the problem or remove ourselves from the danger. But they have to be tightly controlled. So feeling too much pain can be just as harmful as not feeling bad enough. So we can see the brain as constantly having to calculate how much danger we're in and what is the appropriate level of pain or any other symptom that's needed to signal a particular situation or threat. So we often assume that pain is just based on the physical state of the body, that it's a direct readout of what's coming in from the nerves. So there's damage in your legs, say, and you feel that's pain, and then the worse the damage, the worse the pain. The crucial message coming from this research is that it's actually not what happens at all. The brain is actually making a much more sophisticated and integrated judgment that's taking into account not just the physical state of the body, but all of the information that you have about what's gone wrong in a situation and how much danger you're likely to be in. So damage in the body is one factor. It's important, of course, but this judgment is also including other things like physical cues in your environment, for example. So you'll immediately feel more tired if it's hot, or if you're at the top of a mountain and oxygen levels are low, or if you're ill. And that's not because your muscles are suddenly worn out. It's because your brain senses that exertion is likely to be more risky than usual. So it's trying to sort of give you the symptom to dissuade you from exercising, to keep you safe before any damage occurs. And this calculation that the brain is making is also including your psychological perception of a situation. So how you interpret what's going on around you. So if you imagine that you are eating a meal with friends and everyone around you suddenly starts throwing up, the chances are that you'll start to feel sick too and stop eating, even if there was actually nothing wrong with your food. So the brain is taking into account your belief about your situation, that the food might be poisoned, and it's factoring that perceived risk into the symptoms that you experience so that you can respond immediately, stop eating, keep yourself safe. So we don't know this is happening, we just feel bad. And these processes are happening all the time. We can't ever separate the symptoms that we're feeling from our broader perceptions and beliefs about ourselves and the world. I need to go back one. There we go, about ourselves and the world and the situation that we're in. So generally, if we feel stressed, scared, alone, you're worried about a certain condition or symptom, then that can trigger biological changes in the brain that amplify that symptom. The brain's trying to tell us that there's a problem, we really need to do something about it. But on the other hand, if we feel safe, cared for, we believe that we've received effective medical treatment, we're about to get better, the injury itself might not have changed, but the brain is able to conclude that the crisis is over. It can dial that symptom back down. And I think it's fascinating how well this realization, how much our beliefs influence what we perceive, fits with neuroscientists' latest ideas about how conscious experience works more generally. So what we see or perceive doesn't just depend on what's coming into our eyes and ears. The wider meaning that we bring to it also matters. So with this picture, for example, we can interpret this picture in different ways. We literally see two different things, a duck or a rabbit. I'm hoping that you can all see those, depending on how we look at it. And if I were to show you a whole series of pictures of ducks and then show you this, you would be more likely to see a duck first because that's what you're expecting. And if I showed you a whole load of rabbits, the first thing you'd see would be a rabbit. Or for another example, I don't know how many people remember this picture of a dress that went viral a few years ago. So some people see this as blue and black. I don't know how many blue and black we've got. And others are convinced that it's white and gold. Any white and gold? Psychologists think that the difference stems from different unconscious assumptions that our brains are making about the lighting conditions when that photo was taken. And that in turn depends on our sort of unconscious expectations, which according to our life history, so whether you've spent a lot of time indoors or outside when you were younger, for example. So depending on our prior beliefs and expectations, and this can be unconscious, we've got no idea this is happening, that exactly the same sensory input can lead to dramatically different experiences. And we're not aware of this going on, we just see a different world. And placebo effects tell us that it's just the same with how we perceive our bodies as well. Every symptom we feel is not a direct, simple readout of actual physical damage, but it's an integrated picture, and changing the meaning of a situation, for example, when you receive medical treatment, that can cause the brain to reinterpret the sensory signals it's receiving, and your pain can go down. This is happening with all pain and other symptoms, but these psychological and historical factors can be particularly important for people with chronic conditions. So if you've been in pain for a long time, the brain can develop an automatic unconscious bias toward the conclusion that something is wrong. It interprets sensory data that healthy people would dismiss as random noise, they wouldn't even notice, as painful. And this may help to explain why some people with injuries often still suffer pain even long after the actual physical damage has healed. Or in long-term conditions like arthritis, the pain that people experience bears little relation to the actual state of your joints. Some people have got slight damage and a lot of pain. Other people have major damage and minimal pain. In some conditions, people can suffer constant agonizing pain without any apparent physical injury at all. So this understanding the central importance of our mental state in determining what we experience, I think gives us an interesting perspective on alternative therapies. So treatments such as Reiki, homeopathy, acupuncture, often when they're tested in clinical trials, they work no better than placebo or fake versions of those therapies. And the conventional scientific assumption would be, well, they can't beat placebo, they don't work, throw them out. But once we realise the placebos can in themselves create powerful effects that can help patients, I don't think that conclusion any longer makes any sense. So just to give you an example, there was a huge trial a few years ago of acupuncture for chronic back pain. There were more than 1,000 patients in this trial. And the researchers compared acupuncture with fake or placebo acupuncture, where the needles are put in the wrong places and they're retractable so they don't properly penetrate the skin, so the person thinks that they're getting acupuncture, but really they're not. And in this trial, there was no difference between these two groups, the real acupuncture and the fake acupuncture. So normally the conclusion would be, well, that's failed, the acupuncture didn't work. But in this trial, there was a third group. The third group got conventional painkillers. They did barely half as well as either of the groups who got the acupuncture, whether it was real or fake. So even the placebo acupuncture worked nearly twice as well as the drugs did. And results like this tell us two things, I think. First of all, alternative therapies aren't always necessarily working in the way that's claimed. Placebo versions are often just as powerful, but that doesn't mean that there isn't any effect there. It just means that the most important factor may be how these therapies are harnessing elements like care, hope, ritual, expectation to shift patients' beliefs about their bodies. These results are also telling us that in many cases, conventional drugs and surgery are trying to fix the wrong thing. So particularly for chronic symptoms that aren't easily explained by ongoing physical damage, instead of treating the body, we need to target the mind. So hopefully I've convinced you so far that placebos are about a lot more than fake pills. They're actually telling us something much bigger about the crucial importance of feeling safe, positive, cared for in how ill or well we feel. Our beliefs about ourselves and the situations that we're in are continually being translated into changes in brain chemistry that shape what we experience. So that's really important. But sometimes that isn't enough. Sometimes there is physical damage that we want to prevent or fix. So can we go beyond how we feel? Can our thoughts and beliefs go beyond the brain, if you like, to change the underlying physical progression of health and disease? So to start thinking about that, I would like you to take a look at these lemons. Imagine picking up a piece and taking a bite. So visualize it if you can. So sink your teeth into it, swallow that acidic juice. And if you've eaten lemons before, you might start to feel a tingling at the back of your mouth here. I always do when I talk about this. That is your salivary glands switching on. So your body has previously learned the appropriate physiological response to a lemon. It knows that it will need extra saliva to deal with that acidic juice. And we wouldn't normally think of that as being under conscious control. I couldn't say to you, switch on your salivary glands, please. But we can use a thought or an image to make that change happen. It doesn't matter that you know it's not a real lemon, it happens anyway. And this is an example of a physiological change called a learned or conditioned response. These responses are controlled by the brain, and essentially we learn to associate a sensory cue or set of cues, maybe a taste or a smell or a sound or a certain environment, with a particular physical response. And then when we experience that situation again, the brain triggers the same response. And these responses are controlled by a branch of the nervous system called the autonomic nervous system. It runs from the brain to organ systems throughout the body, the gut, skin, heart, lungs, eyes, even the immune system. And it enables the body to respond to physical challenges that we perceive in the environment. And the key thing here is that just as we saw with placebo effects, our bodies don't always wait for physical challenges or to happen, to hit us directly before responding. We can use what we perceive in the world around us to get prepared, to stay one step ahead. We know from experience, if we've had lemons before, that round yellow shape I showed you is associated with acidic juice, the need for extra saliva. So the next time we come across that shape, that cue, the brain has learned, and that change, that response is triggered in advance. We're ready for the lemon before we even take the first bite. And these kinds of changes are happening in our bodies all the time without us necessarily realizing it. So every moment, what you perceive, think, expect, even imagine is feeding through not just into symptoms you feel, but your wider physical state. And this depends on a web of associations and meaning that we build up through our lives. So whether you're preparing for food or to climb a set of stairs, you might be rushing for a train, responding to a fire alarm, a dog bark, a baby's cry, maybe you're relaxing with friends or recoiling with disgust at the sight of those maggots. All of these things are having a physical impact through your mind, through what they mean to you. Our brains and bodies work together, learning from experience what physical changes are needed in different situations so that they can trigger the same again when needed in the future. And there will be some responses that we all have in common and others will be different for everyone. Interestingly, these responses don't tend to be strongly affected by conscious beliefs, verbal instructions, or rational thought. As I mentioned, I couldn't just say, switch on your salivary glands. Instead, they're tightly linked to our history, and they're driven largely by sensory and emotional cues, images, memories, smells, sounds, tastes. And I think this helps to explain why some non-drug approaches like hypnosis and aromatherapy can be effective. If we want to use the brain to nudge or shift physiology, we can't just necessarily tell our bodies what to do. Instead, deep-seated associations and sensory environments like rituals, imagery, music become important. So, those are some of the mechanisms that connect our mental and physical state. But can we use these insights to actually treat disease or improve our health? And at the moment, we often face a choice. There are conventional interventions, drugs and surgery that are hugely valuable, but can also cause harm, like side effects, complications, addiction. And for some common conditions like chronic pain or irritable bowel syndrome, they are not effective at all. Whereas alternative therapies can often effectively harness belief, but they're not evidence-based, so we don't know what works and what doesn't, and patients can miss out on conventional treatments when they need them. But what if we were to treat body and mind together in an evidence-based way so that we get the benefits of both? And I'll come on to some approaches we can use in our everyday lives, but first I just wanted to give you a few examples that scientists are testing of incorporating mindset into conventional medicine. So this isn't just about giving people placebos. One set of approaches being tested has to do with changing how existing treatments are delivered. So doctors are incorporating active ingredients like positive expectation, empathy, stress reduction alongside drugs and surgery. So trials in chronic conditions such as irritable bowel syndrome, acid reflux disease and chronic pain have shown over and over that things like having an empathic therapist or longer appointment times, things that help patients to feel cared for, listened to, hopeful, dramatically improve outcomes regardless of the treatment given. And I think these are really important findings, given how much that we're spending on drugs while cutting back on human factors like nursing staff and appointment times. That's likely to be a really counterproductive approach. But psychological factors are also important in treatments for other kinds of conditions, from heart disease to cancer. One interesting study recently involved targeting patients' mindset before they receive treatment to try and boost their expectations for it. So this was a trial looking at patients facing major heart bypass surgery. It's really serious surgery. Some patients never fully recover. They're left with lifelong disability afterwards. And so the researchers gave patients some therapy sessions beforehand where they encouraged them to visualize how they were going to enjoy their lives after the surgery. They made a plan for how they were going to get back to all of the activities that they wanted to do again, whether it was walking or gardening. And 6 months after the surgery, compared to control groups, those patients had significantly less disability, a higher quality of life. They were working many more hours a week. And not just that, they also had lower levels of inflammation. This is a harmful stress-related immune response, suggesting that their hearts were actually healthier as well. In another recent study in children undergoing immunotherapy for serious food allergies, when the doctors talked to the kids beforehand to reduce their anxiety about the treatment, they suffered fewer side effects, but also their immune systems responded better to the treatment as well. Other teams have been changing how they interact with patients during medical care. So in trials of minor surgeries, for example, where patients are awake for the procedure, staff have changed their language and their behaviour to help people to feel more relaxed and in control during the surgery. And as well as drastically cutting levels of pain and anxiety, there's also significantly reduced the risk of serious complications, things like excessive bleeding and dangerous drops or spikes in blood pressure. A similar approach helped women who were undergoing surgery for breast cancer, so they recovered better with less pain and fatigue after the surgery, but also they had reduced levels again of inflammation. And that's particularly important here because inflammation is involved in the progression of cancer. So one of the risks of breast cancer surgery is that inflammation caused by the physical and mental stress of the surgery can increase the risk that the cancer spreads. So anything that can reduce that inflammation is really important for outcomes. So in all of these cases, shifting meaning, just paying attention to patients as people, makes us feel better, but it also makes the treatments work better as well. Scientists inspired by mind-body connections are also coming up with completely new kinds of therapies. So just to give you one example of that, psychologists in Germany are developing an immunotherapy treatment that's based on conditioned responses, like we saw with the lemons, where we learn to associate a colour or a taste with a particular physical change, in this case, a particular immune response. So rather than lemons, they're using this drink. It's made of strawberry milk, green food colouring and lavender oil. I've tried it. It tastes really weird. It's like nothing you've had before. It looks green, but it tastes purple because of the lavender. It's milky, oily, bitter, sweet, all at once. Very distinctive, hits several senses. And what they've shown is that if you drink this drink at the same time as taking a drug, in this case a drug that suppresses the immune system, and you do that several times, your body learns to associate the distinctive look and taste of the drink with the effect of the drug. And once that's learned, just drinking this drink on its own will suppress the immune system in just the same way. And I think in all of the research that I've investigated, looking at mind-body links, this is one of the things that surprised me the most. You can train your immune system to respond to taste and smell. And the researchers have shown this in healthy volunteers, also in patients with dust mite allergy, where they replicated the effects of an antihistamine medicine. So after this learning process, you just drink the drink and that allergic reaction is reduced. And most recently, they've been testing it on kidney transplant patients. So these patients have to take powerful immunosuppressants every day to prevent immune rejection of that transplanted kidney. So the drugs are life-saving, but they have horrible side effects and they're very toxic, especially to the kidney. So often patients will lose their kidney because of the toxicity of the drugs. But using this technique, the researchers were able to replicate the drug effect in these patients as well, so using that drink to reduce the immune responses associated with organ rejection. And the hope is that training patients' immune systems in this way to respond to lower drug doses will cut the side effects and help those transplanted organs to last longer. Scientists are also studying this approach in arthritis, lupus, multiple sclerosis, that are all treated with immunosuppressants, and even cancer, where some drugs target the immune system. So we're just at the very start of this revolution, but I think there are already some exciting hints as to how medicine could maybe look different, where we have effective physical treatments where needed, but we use them much more judiciously, where we take mind-body connections more seriously, even in life-threatening conditions like organ transplants or cancer, and where doctors harness not just chemicals and scalpels, but sights, sounds, smells, expectation, hope, care in an evidence-based way. So for the last few minutes, I want to say a bit about what happens before we get ill? What does the science say about how we can harness our minds to optimize health, well-being, physical performance throughout our everyday lives? And this is a huge topic, but I want to highlight just two important themes that emerge from the research that I've already talked about, and those are the power of changing the meaning of a situation and of building empathy and human connection. So when we're hurt or ill, both of these things can help us to feel safe and cared for, and that translates into reduced symptoms and healing responses in the body. And for me, these two themes are also what comes out most strongly when we look at the research on lifelong health and well-being. So let's have a look at how these two things can combat what's maybe the biggest cause of chronic disability and disease through our lives, which is stress. So when we're afraid or nervous or stressed, this switches on fight or flight responses which alter physiology across the body. So your heart and blood pressure rise, your pupils dilate, sugar is released into the bloodstream to fuel your next move, blood's diverted from your stomach to your limbs and brain. Stress also triggers inflammation that I've been talking about, which is a first line, kind of quick and dirty response to infection and injury. And all of this is important for helping us to survive an immediate physical crisis, but if we're stressed all the time and these responses are switched on long term, then that can cause wear and tear, seriously damaging the body over time. And we all know that stress is bad for us, but I was surprised when I researched this just how bad and broad-ranging these effects can be. So chronic stress contributes to heart problems, skin disorders and gut conditions, as well as obesity, diabetes, depression, dementia. Constant stress also plays havoc with our immune system. It impairs our response to vaccines, contributes to allergies and autoimmune conditions. It makes us more susceptible to infection. It triggers inflammation, which over time can disrupt wound healing and eat away at healthy tissues. The physiological changes caused by stress play a role in some cancers by inhibiting DNA repair and helping tumors to spread. Stress even makes our cells age faster. So maybe you're thinking, well, how can I get as far away from stress as possible? But the interesting thing is that most of this damage isn't caused by the physical events themselves, but what those events mean to us and how we respond to them. Some people can ride out huge challenges feeling fine, even energized, whereas others can be overwhelmed by even minor adversities or frustrations. So reducing harmful stress isn't just about avoiding problems or having an easy life, but changing how we think about situations. And one key factor that psychologists identified is whether you see a situation as a threat or a challenge. So at the top of that ski slope, do you see a terrifying risk of injury or the promise of a really fun ride? If others around you are angry or in distress, do you recoil with anxiety and fear, or do you see a chance to reach out and make a connection to help someone who is in pain? And when we're in a threat state, we're generally focused on the risk or potential harm to ourselves. And as well as raising heart rate, the body responds by constricting blood vessels and triggering inflammation. This is an evolutionary response. The body is essentially trying to minimize blood loss and damage in case you get injured. But the blood then can't sort of flow well efficiently around the body, so this strains the heart and it impairs our performance as well as eventually our long-term health. In a challenge state, on the other hand, we're focused outwards on opportunity, the potential benefits rather than loss or threat, and the body responds differently by supporting and maximizing our performance. So heart rate still rises, but there's less inflammation and blood vessels actually dilate so that oxygenated blood can flow more easily to around the body. It can reach our muscles and the brain. And short bursts of stress like this, it turns out, are actually good for us. So just as physical workouts make us stronger and fitter, we need psychological workouts as well. So regular, small to medium challenges that stretch you, but that you are confident you can achieve, will help make you more resilient to future stress. There's also some interesting research on how we can shift ourselves from threat to challenge by changing how we interpret the situation. This is called reframing. One interesting study was done on students who were facing an important, stressful exam. So researchers told the students beforehand that if they felt physical signs of anxiety, heart racing or butterflies in their stomach, that this was a good thing because it meant that their body was helping them by pumping oxygenated blood to their brain. So this was going to help them to do better. It was a really tiny, simple thing to say, a small mindset change, but compared to control groups, it was enough to shift the students' physiology from threat towards challenge. And not just that, they scored significantly better on the exam as well. In general, the research shows that preparation is key. So if you are facing a challenging situation, it matters whether you have the resources to cope. There isn't a magic way to alter reality and win regardless of the odds. You do have to study for the exam. But in the moment, there are things that we can do to optimize both our performance and the long-term health effects that stress will have. So above all, don't let yourself dwell on negatives. Try to actively focus your mind on the positives. And I mean that firstly in terms of your resources. So remind yourself of the skills, experience, social support, whatever it is that you have that will help you. So that exercise that I just mentioned about thinking of your body as helping you and supporting you is an example of that. And also actively focus on positive outcomes. So visualize what you have to gain, or even better, what you have to give in a situation rather than what you could lose. And the evidence shows that shifting your focus outwards in this way will help to tip the balance in your favor. Studies show that even shifting towards thinking about stressful situations generally as positive opportunities for growth rather than a threat to be avoided improves both our performance and our physiological response to stress. And the other biological shield I want to highlight that can help to protect us from the effects of stress is social connection. So from lab studies of gene expression to epidemiological studies showing that follow the health of hundreds of thousands of people over decades, there is lots of evidence now that loneliness amplifies the biological effects of stress. Social isolation is just as harmful for our health, it turns out, as drinking and smoking, and it's more dangerous than lack of exercise or obesity. On the other hand, socially connected people have healthier hearts and healthier immune systems, they don't get as sick, and they live longer. Unfortunately, it's not always as easy just to be more social. After years of loneliness or rejection, people can start to see others as hostile, as a threat in themselves. You can't just take a chronically lonely person and put them in a crowded room. They would find that really stressful. But the research shows that the best way to combat loneliness is not just to encourage physical contact, but to change how we think about social relationships. And it turns out that a very effective way to do that is to encourage altruism. So essentially helping people to focus less on themselves and more on what they can give to others. So things like volunteer work, acts of kindness, older people writing diaries of their wisdom to pass on to younger generations. These have all been shown to improve well-being and feelings of social connection, but also physical health, including immune function. There was a lovely project in Baltimore in the US called Experience Corps, where elderly people spent 15 hours a week helping kids in deprived elementary schools to read. And this helped the kids, but the most dramatic effects were in the older volunteers. They became physically stronger, they performed better on cognitive tests, and their brains started to look younger. And I think this is a fascinating perspective on social connection, that interventions that are the most effective in diffusing feelings of social threat are those that encourage people to focus on others, not themselves. So what they can give to an interaction, rather than what they're getting out of it. And I think maybe that's something valuable for all of us to think about when we interact with others. Can we focus on what we give rather than what we get? So I'm going to leave you with my favorite example of how to shift our perspective, though, which is the emotion of awe. Now, this is that wow feeling we get when we're confronted by something vast, that's so huge it dwarfs us, that we struggle to put into words or to comprehend. And research shows that awe has very interesting effects. After experiencing it, people become more creative, more curious, they feel happier, less stressed even weeks later. And there's a distinct shift in perspective that psychologists call the small self phenomenon. So people, after feeling awe, estimate their physical size as smaller, they draw themselves smaller, they sign their names smaller, but at the same time they feel more connected with others. They become more generous, make more altruistic decisions, they're more likely to help a stranger, people care less about money and more about the planet. And these psychological shifts feed through into our biology, so more than other positive emotions that have been tested, like pride or amusement or joy, or reduces that harmful inflammation. It also acts through the autonomic nervous system to turn down stressful fight or flight responses and instead promote relaxation responses, sometimes called rest and digest. And if you want to get some awe, you can seek out mind-blowing, transcendent experiences like this gorgeous starry sky, but it also works to find awe in small doses, just a few minutes at a time. In a study that came out in 2020, US researchers asked people to take 15-minute walks outdoors once a week for 8 weeks, and they asked them to look around them as they walked for experiences of awe, because awe doesn't necessarily have to be physically big, it can be conceptually vast. You might find it by marveling at the complexity or beauty of a tiny insect, or at the interconnectedness of a tree and all of the species living in it. And compared to people who took normal walks without any special instructions, the people who looked for awe felt greater joy and connection with others as the weeks went past and their stress levels dropped. And one lovely detail from this study is that the participants were asked to take selfies while they were on their walks, and these showed how their perspective shifted outwards away from themselves. So over the weeks they featured themselves smaller and smaller in the photographs, with the images focusing more on the landscape around them. And I love this work on awe because I think it shows really nicely how we can connect personal health and well-being with wider well-being of our society and the environment. So confronting vastness, what's beyond us in every sense of the word, seems to force our perspective away from our small personal daily concerns and towards that bigger picture. And that in turn makes us feel more connected, more generous and less materialistic. And as well as improving our own health, we treat each other and the planet better. So just to conclude, I think the problem with a lot of the debate over mind-body medicine or healing thoughts is the idea that harnessing the effects of the mind on the body is somehow unscientific. It's an assumption that you see on both sides, either alternative healers claiming that the power of the mind somehow transcends science, or the skeptics saying that the mind has no power at all. I think that taking account of the effects of the mind on the body is a more scientific approach than ignoring it. The evidence shows that the effects are not mysterious or magical, they're just biology. We've evolved so that psychological cues guide both our symptoms and our underlying physiology to keep our bodies one step ahead of a changing environment. And that means there are clear limits to what the mind can do, and we can't simply will changes to occur, but understanding how and why the brain influences the body can, I think, help to point the way towards a more interconnected, effective, and human view of medicine and health. So that's the end of my talk. There is some more information about me, my work, my books here. Thank you, and I'm happy to take any questions that you have.
Joe, thank you so much for an amazing talk. I don't know about you, but it's kind of left me feeling hopeful for the future about this area of science that seems to be needed to explore a bit more, hopefully by the generation of scientists that are coming out of Eltham College. From oxygen deprivation to Italy and blue drinks in Germany, childbirth, acupuncture in the USA, that was truly fascinating. thank you all for coming tonight. Please do take a photo of Joe's books on the board if you'd like to get them on the way out. There's Cure in the middle. The book on the left is about the antikyra mechanism, the world's first computer. And I think Joe's latest book on the right is The Human Cosmos, about the relationship of our society with the stars. And Joe, thank you so much for coming to Elton College. And by way of thanks, we have this little gift for you. Let's please put your hands together. Joe Marchant.